The WINNN program is basically it's an acronym which means working to improve nutrition in northern Nigeria. And my role in the WINNN program is basically from UNICEF side. I'm the head, the team leader, the chief of nutrition for UNICEF. And WINNN is actually implemented by UNICEF, Save the Children, and ACF. So I lead the nutrition team. Northern Nigeria, basically, the easiest way to understand is that, we have disparities in the way malnutrition is distributed. The most affected regions is the Northwest, Northeast, and then to some extent North Central. So here you see that in Northeast, Northwest, 1 in 2 kids are stunted. And then also we have levels of acute malnutrition very high. In some states, over 10% wasting. The WINNN program consists of a minimum package, that is treatment of acute malnutrition through CMAM, promotion of infant and young child feeding, and then provision of micronutrients, and these are vitamin A supplementation, iron folate supplementation for pregnant women, and then deworming. We also have another component which focuses on policy, advocacy, and coordination. I think what we're learning now is basically, and that's our interest, what we are learning so far is that this minimum package, we have to start to see where are we likely to make the biggest impact. Is it working at health facility level, working at community level, or working through campaigns? And what we are discovering more now is that we need to strengthen the community component of our work. The two things that are working really well in the program, first is the treatment of acute malnutrition, because that has been going on for some time and there's a lot of institutional experience. And we are also now very excited about the infant young child feeding through the creation of community support groups. There's a lot of excitement, and we have a good number of these mothers who are coming together to discuss best practices on how to feed infants and young children. The 2 to 3 things I would say: number one, we need to strengthen the operational side of the program, because we have a component of operational research in this WINNN. So it's helping us to understand the flaws in terms of how we are executing. Number one, we have these campaigns which we call the Maternal Newborn Child Health Weeks. We're learning a lot about how we need to strengthen social mobilization. We're learning a lot about how we need to involve the traditional and religious leaders. We're also learning more, and we need to improve the way we are engaging the communities, because we work with volunteers. We want to see how we can sustain these volunteers, maybe by helping them create some associations, and also empowering them through income generation activities. And then we also, the third thing, hope that our experience working in these 15 local government areas supported by WINNN should be able to catalyze bigger activities in the whole of northern Nigeria. Yes, personally I've learned a lot. I think one of the things I've learned is that you can't make too many assumptions, especially when it comes to working with communities. You just have to engage them, you have to talk to them, you have to unleash their own capacity. So solutions do not come from outside, but they come from within the communities through the way we engage with them.